So a single episode may predispose one to future episodes. It can be a singular, and certainly, I guess sort of in the good news department, when people are getting the help they need for the trauma, that they're being able to work through it and recover, work on a, not just sort of purging it, but also working on a recovery plan with a social worker or behavioral health provider. Certainly, sometimes I've seen people do this with the support, with the talk therapy trauma support, as well as medication support, like an antidepressant, for instance, can bring about a recession of the dissociative amnesia. And if they're having, if they've had multiple episodes of it, once they're able to begin to work on, work on a trauma recovery plan with a professional and with the right supports in place and self-care plan and medication support if appropriate, I've seen people, those episodes begin to recede and become fewer and farther between, and eventually stop occurring. So again, it's just in my own experience. A person is not necessarily acutely symptomatic, either from a dissociative perspective or a mood or anxiety perspective. Some people may be functioning pretty well, particularly if they're getting the help that they need, and they've got they've got support for a self-care plan. They're availing themselves of it. They may still experience those dissociative amnesia episodes, but have less symptom, mood, dissociative or anxiety type of symptom in between those episodes of amnesia. And then, the idea hopefully is that over time, the episodes of amnesia as well begin to recede. Now, the other end of the spectrum can be equally true, that some people may have severe depression. They may have, certainly, a person can have a bipolar disorder in addition to a dissociative disorder like dissociative amnesia. Certainly people with suffered adverse childhood events and other forms of, particularly severe trauma, are more likely to experience generalized anxiety disorder, major depressive disorder, and they may be symptomatic along those lines, in addition to dissociative symptoms in between amnesia episodes. Okay. The length of period, absolutely, I've seen that. And sometimes, actually, as a side, people can get misdiagnosed as bipolar. It's purely from my own experience, not from the DSM, because they can have dissociative fugue and dissociative amnesia that lingers for days, maybe even, maybe a week or so. I don't know necessarily that I've seen weeks on end, weeks plural on end of dissociative fugue or amnesia, but certainly, someone who may experience it for 30 minutes or, several days or week. That can be, that sort of episodic nature to it can particularly if they're engaging in high risk behaviors during the amnesia or fugue episode, which, will not necessarily happen, but it can happen. And those folks can be confused as having a manic episode. Sometimes the course of talk therapy work is about bringing up memories that are, have been pushed down, repressed, and not immediately retrievable. This can be very difficult work and very painful for the client during the course of that work, but getting those memories retrieved again, sort of pulling them out of of where they're living. And sometimes I will say to folks, I'll use the analogy of you think of Chernobyl or other toxic waste, where we'll try to bury it under tons and tons of concrete and steel, yet the toxicity still seeps out into the environment. That's sometimes how I liken these these repressed memories where the brain has understandably locked them away because they're so painful and so distressing. But unfortunately, at least in my experience doing this work, that those things just don't stay completely locked. It just, again, like a forms of toxic waste. You bury it, just not, you can't bury it deep enough to keep the toxicity from seeping out and poisoning the person in an analogous way to poisoning the environment. So that's not from the DSM. That's purely from myself. And sometimes I've used that analogy with clients, and they found it helpful. So doesn't mean you have to. Just something I share with you.